So pneumonia is the infectious and inflammatory process involving alveoli and connective tissue. So it's an acute inflammation of the lung tissue in response to like various microbes or inhaled slash like aspirated foreign substances. So some outcomes regarding pneumonia would be having lung excess, pleural effusion, emphysema, bacteremia, sepsis, and respiratory failure due to like decreased oxygenation and or like decreased ability to eliminate CO2. So the elderly population are more at risk for impaired gas exchange because they have decreased lung compliance and weakened accessory muscles, increased risk for infection, decreased ability to cough, and increased risk for aspiration. So how do these microorganisms get into the lungs? So we have these defense mechanisms such as the mucociliary defense. So that is like when you produce like mucus and stuff in order to like trap the microorganisms or like foreign stuff, and then the ciliary, it pushes it out. So that's what that is. And then you have the macrophages. So macrophages, they like attack any like bacteria and stuff to get rid of it. And there's a cough reflex, so you're just like coughing to expel that microorganism. So with all of these, you can get pneumonia. So there's a few different types of pneumonia. There's lobar pneumonia. So that's like when, as the name implies, like a lobe is affected. And then there's bronchopneumonia, so multiple spots in the lung are affected, and this is atypical. This is typical, I mean. And let's see. And then there's also interstitial pneumonia, so interstitial space of alveoli are affected, and that's atypical. Typical pneumonia is like bacterial, so that's when exudate fills like the alveoli, and there's like a rapid onset. So you'll get like tons of like symptoms and stuff. Because like the bacteria is like multiplying and causing inflammation and accumulation of like the fluid within the alveoli. And then let's see, bacterial, like the person might get like fever, chills, productive cough, purulent sputum, shortness of breath, tachypnea, tachycardia, crackles, and wheezes on auscultation, and sometimes pleuritic pain, so like that chest pain. And then in terms of atypical pneumonia, so that's viral and mycoplasma. So that's when the inflammation, it affects the alveolar septum, and the symptoms are like less like striking. It's probably like due to lack of alveolar infiltration and purulent sputum, and this means that there's like a gradual onset and non-productive cough. So some causes of pneumonia that would include so there's hospital acquired and community acquired. So a hospital acquired is when pneumonia occurs within like 24 hours after hospital admission, and this is mainly bacterial. And then with community acquired pneumonia typically begins in like the community and is diagnosed like within 48 hours of the client's admission to the hospital, and this can be either bacterial or viral. So in terms of other stuff, there's like ventilator associated pneumonia. So there would be like an increased risk for like due to like weakened immunity, and the person can't cough to clear up those microbes. So this is when the microbes enter via a ventilation tube. And then there's aspiration pneumonia. So that would be caused by the inability to clear your airways. So some of the risk factors would include dysphagia, being in a supine position, impaired cough reflex, decreased level of consciousness, and decreased like a gag reflex or swallowing reflex, feeding tubes, like gastric distension, and like maybe stuff like acid reflux. So there's other like risk factors for pneumonia, such as like for decreased respiratory defenses. Some risk factors include smoking, COPD, cystic fibrosis, lung cancer, and immobility. And then for decreased immunity, that would include like age, like older age, or like people very young, like like 2 years and under, immunosuppression therapy, immune deficiency states such as HIV or AIDS, and chemotherapy. And then hospitalization, so if you have like prolonged intubation or presence of NG tubes or just like tubes in general. So some nursing assessments for us to do is obviously conducting a thorough like a respiratory assessment. So that would include obtaining like a history, such as like for smoking and stuff or other illnesses, and then we would assess for like if they have like a cough, like is it like productive or non-productive? Are they producing like sputum? So that could be like an infection or gas exchange impairment. And then we would auscultate the lungs. We might hear quartz crackles because of all that fluid in the alveoli, and that's an indication for infection or gas exchange impairment. Person might be like short of breath and using their accessory muscles, and that's a gas exchange impairment. person might have like increased heart rate, rest rate, blood pressure. There's like compensation, so like for the hypoxia, like they want to get more blood, get things perfused, and get more oxygenation from breathing faster. And then they might have like an altered level of consciousness. That's like a gas exchange impairment, so they might be confused or restless, agitated, and decreased like O2 sats, so that's a gas exchange impairment. Fever, so that's a sign of infection. Cyanosis or cool skin, that's like a compensation. Decreased lung sounds might be an infection, and nutrition. So with all of this like work, like increased like metabolism, increased like to fight the infection and stuff, your body will need more nutrition to deal with it. So some assessment data required would be obtaining like vitals, particularly the SpO2 rest rate and stuff, getting a chest X-ray, getting a sputum sample, culture, like a sputum sample or culture, lung sounds, check like the CWMS, assess the work of breathing, level of dyspnea, so like check how they're breathing, right? And check their CBC, in particular their white blood cell count, and obtain like blood cultures if indicated to see if there's like a blood, like the infection went to the blood or anything. And some treatments for pneumonia would include like antibiotics for bacterial, and then for viral, there's not really much for viral. Just let it go away, or you can use like other like flu like medications and stuff like Tamiflu. And then we should treat the symptoms, like such as using antipyretics such as Tylenol to decrease that fever, to help the body like decrease the oxygen demand, and encourage like fluids and stuff.